Worth Hospital Council's Education and Research Foundation. We're your sponsors today. Hey, it's my pleasure to
Where's the clicker? He said it was up there.
clicker. Hang on. We can't start.
Got it.
There we go.
We're
All right,
good.
got it. Coleen found it. We're good. So it is my pleasure today to recommend and introduce you to Coleen Smith, who is the Director of High Reliability Initiatives for the Joint Commission Center for Transforming Healthcare. Welcome, Coleen, to our soiree today. She's responsible for development and implementation of activities that support the adoption of high reliability practices in healthcare. And I know many of our organizations have committed to high reliability in their work here in our community. So thank you for joining us here today. Coleen joined the Joint Commission in 2004 and the Center in 2011, so she has many years of experience with the Joint Commission. Please help me welcome Coleen. Thank you.
Thank you. Good morning. Am I on? Everybody can hear me? Great. So welcome to the session that stands between you and lunch. Somehow I got this slot last year too, so I'll try to keep it lively and interesting and keep everybody involved in the presentation. First thing I want to mention is just some housekeeping business, that I have no conflicts of interest, and this is just our standard disclaimer. This information is up to date as of July 12th. So today we're going to talk about a couple different things. We're going to talk about how you evolve into a learning culture at your organization, and how that then supports or is supported by a reporting culture. I'm going to talk a little bit about objective accountability evaluation or assessment tools. That's such a long name. It's the generic name for a Just Culture algorithm. And we're going to talk about close calls and what those are and what are unsafe conditions, and talk about the learnings that you get from those. As you all know, you're probably seeing many more close calls at your organization per day than you are actual harm incidents. So what's the difference, and why should we focus on the close calls? And then at the end, we're going to go over the action steps that you should take at your organization to support and develop this learning and reporting culture. I want to get a sense of who is in the room. How many folks in the room are in a hospital right now? How about ambulatory? A couple ambulatory. Behavioral health? A few folks there, okay. And how about home care? Anybody from home care? Working in home care as part of your system? Okay, great. So a lot of hospital folks. So if you are accredited by the Joint Commission, then you know that we have several parts to our business. We have the part that focuses on accreditation, which is the last speaker. Lisa is in that segment of the enterprise. Joint Commission Resources handles our education and consulting, and Joint Commission International handles all of our international accreditation. But the Center for Transforming Healthcare came on the scene 10 years ago. We're the newest part of the enterprise, and our mission is in part to transform healthcare into a high reliability industry. Regardless of which segment we're talking about, we all have the same vision that you see there on the slide. But the Center for Transforming Healthcare does not get involved in anything standards related. So don't ask me any standards questions, because I won't be able to answer them, okay? So what is high reliability in general? You've probably heard this term a lot. You might even be working on it in your organizations. And high reliability is really the ability to avoid catastrophic outcomes. If you have a bad thing happen in your high reliability organization, it doesn't disable you. You are able to recover from it quickly, but a lot of the time you're preventing anything getting even close to a harm event. So that's places like nuclear power facilities, aircraft carrier flight decks, amusement parks, and zoos. Even zoos are considered high reliability organizations. But high reliability in healthcare has a little bit of a different perspective because we offer so many different things in our organizations. And so our definition at the center is maintaining consistently high levels of quality and safety over time and across all settings. That's a lofty goal, but it's also the right goal. And one of the things that helps you get further in high reliability is that reporting culture. The Joint Commission developed a healthcare high reliability maturity model. The citation for it at the bottom of the slide, if you just Google the word high reliability, that article will be one of the top 5 hits that you get. We don't pay for that, it's just how popular the article is. It was published in 2011 by our president, Dr. Mark Chasson, and our late executive vice president, Dr. Jared Loeb. And it talks about the fact that there need to be 3 major changes in healthcare in order to be able to move towards high reliability. The first of those changes is you have to have a leadership team, specifically a senior leader, the CEO or president, that is committed to the goal of zero harm. You'll notice I didn't use the word preventable and I didn't use the word patient. Commitment to zero harm means that you don't consider whether or not something's preventable in how you proactively look for safety risks. The reason for that is things that weren't preventable 10 years ago are preventable now. So you don't want to artificially limit yourself. CLABSI, central line associated bloodstream infections, case in point. 10 years ago, nobody was at 0 for that. Most places are able to sustain 0 for months, if not years at a time. I didn't use the word patient because high reliability organizations are as concerned about their customers as they are about their staff and about their visitors. If you've had a chance to go around the tables out there, you might have gone by the table that has the temperature monitoring device for visitors and vendors coming in. That's an example of thinking about high reliability, how you screen your visitors to make sure that they're healthy and are okay to be in your facility and that they're also not impacting your patients. The second one of these major changes is that we need to develop in healthcare a safety culture that's fully functional, which means that anyone within the organization feels comfortable speaking up. If a physician comes into a patient's room and starts to interact with the patient without cleaning his or her hands, if there's a housekeeper in that room, that housekeeper should feel fully comfortable saying, "Doctor, I noticed you didn't clean your hands. Would you mind doing that before you touch our patient?" That is not likely to happen in a lot of places right now, and we know that, but it's a goal. And so empowering staff to speak up is where we're going to focus today. And the third major change is having robust performance or process improvement capability at your organization, using tools like Lean and Six Sigma and formal change management that help you tackle those complicated healthcare conditions that we continue to see around the country. So the safety culture domain has 5 components within it. 5 things that support that overall empowerment to speak up. The first one is trust between staff and leadership. We know for a fact, and I'm sure you probably have this level of awareness as well, that if staff report things and never hear about what happens to those reports, if they go into a black hole, they're going to stop reporting. I see nods all over the room. It's our number one challenge in terms of developing trust. But the other piece too is you have to trust that you're not going to get yelled at or fired on the spot for reporting a mistake or an error or a problem or even a harm event. The second piece is accountability. What are the ways that we hold staff blameless for honest mistakes that are system generated? And what are the ways we hold people accountable for willful disregard of policy and procedure or lapses in performance? Identifying unsafe conditions is the hopper, if you will, for that reporting. Unsafe conditions could be something as subtle as a spot of water on the floor that you think, oh, where'd that come from? I'll wipe it up when I come back this way, and forgetting about it. And one little tiny spot of water and somebody falls and somebody gets hurt. They could also be as overt as pharmacy changing up how they're loading medications, for instance, into your medication dispensing cabinet and putting 2 look-alike medications right next to each other. And in the past that they haven't done that. That's an unsafe condition. We're going to talk about problems as well. Problems like I can't ever find an IV pump when I need it. That's an unsafe condition. So having your staff's awareness changed up about the things you want to hear about is where we're going to spend our time. Using that information will help you strengthen your systems proactively, which we're not great at in healthcare yet, but we will be. That means that root cause analyses will be fewer and far between because you're going to have done proactive risk assessments on your major safety systems and you're going to have removed the problems that live there. What was the problem in your medication management system that allowed 2 lookalikes to go into the cabinet right next to each other? And then finally, assessment. You can't know where your issues and opportunities lie in the safety culture unless you ask people questions about it. And when you ask them those questions, you should plan to do something with the answers. Because staff have constantly told leadership teams, I've reported what my concerns are. I don't see anything changing around here. Do you even do anything with these assessments? So I talked about trust a minute ago. Here's why it's essential to optimal reporting. If you don't have a situation where staff don't believe they'll get in trouble, they will report more, right? We have found that if you implement a good catch program, or some people call it a close call hero, whatever it is you want to call it, that is going to also help generate reports because you're recognizing the reporting. And if you recognize it versus talking about, I've actually heard reporting systems in organizations used as a verb. So whatever your reporting program is, you hear people saying, I'm going to X you. I'm going to report you, but they're using the name of the reporting system. It's not a verb. It's a way for you to find out about bad things that are happening. It's the way that you're going to ultimately fairly assess